Emory's Office of Critical Event Preparedness and Response, or CPAR, recently led a region-wide disaster drill at Dobbins Air Base and Emory University Hospital called Operation Gateway. CPAR's senior administrator and exercise director on site is Sam Charter.
The key is command and control. The command infrastructure that's used nationally across this country, the National Incident Management System, is designed to ensure that objectives are set and that all work is done to achieve those objectives so that we're not wasting energy doing things we shouldn't do at that very moment.
Yeah, there's like 4 more girls.
The exercise was designed to help train first responders and hospital clinical teams on how relief efforts might unfold if an improvised nuclear device were to be detonated in a major U.S. city.
On your command.
That's probably the most challenging event that this country could have to respond to. And it takes a team of players to be able to provide care and to respond to those incidents.
The Air Force is here with their airplane. There's some Army folks here. The State Defense Force is here. Gwinnett and Atlanta Fire Departments are here.
Military teams unloaded mock victims from a C-130 at Dobbins as if they had been transported from the imagined bomb site in St. Louis.
You can't sit behind a desk or a table and talk on the phone about what it's like to pick up a stretcher, actually feel how heavy the patient is, move to a stanchion that'll move around the floor because it's light, put that patient down, examine them, then decide where they're going to go as it relates to their care, and then the movement from these care sites into the ambulance bus. That's impossible to simulate on a tabletop exercise.
As surreal as it might seem, this is one of the national planning scenarios. This is something that the federal government, through its Department of Homeland Security, have considered as a possibility, even if it's a remote possibility, as something that as a government, as a community, we need to be best prepared for.
No, she's good.
The event was used to test Emory Healthcare and specifically Winship Cancer Institute's capacity to respond to a large-scale incident involving radiation exposure. Emory is part of the Radiation Injury Treatment Network, or RITN, a voluntary group of U.S. hospitals capable of dealing with such an event.
RITN is a program designed to treat patients with bone marrow toxicity after exposure either to radiation from an improvised nuclear device or from some kind of chemical that would cause marrow toxicity.
Their bone marrow is affected, and their bone marrow will no longer be able to produce the red blood cells, the white blood cells, and the platelets that we need to function properly.
Dr. Amelia Langston is a Winship bone marrow expert.
We'll do a general medical triage in terms of how sick they are, but also needing to take into account what their radiation exposure has been, because that's going to help us to predict what might happen hours and days down the road, and that will really determine where they need to be and what kind of care they need.
After the explosion, were you outside or inside?
They will manage these injuries with antibiotics, supportive care, some medications to stimulate the bone marrow, and possibly with a bone marrow transplant.
Emory student volunteers from the School of Nursing and the Rollins School of Public Health, who are members of the Student Outbreak and Response Team, played the role of victims in the scenario.
Never really thought about how they transport people. It never really crossed my mind. I didn't know they had ambulance buses, so that's pretty exciting.
In emergency management, it's all about relationships, maintaining those relationships and having the opportunity to meet each other, understand what each other's needs are, and to be able to work together to get things done so that at 3 in the morning when something bad happens, we're not meeting for the first time and we have a good understanding how we can help one another.
So, yeah, I think we need to make clear, this is not